Alright everyone, in this pre-lab video we are going to go over long bone immobilization. Long bone immobilization works for any long bone in the body except the femur. So tib-fib, forearm, bicep, these concepts apply to all of them. You just have to be creative in how you apply them to that particular area. So anytime we have a long bone fracture, in this case we're going to use this right lower leg as our injury, we need to immobilize the bone itself along with the joint above and the joint below to prevent movement. So in this case we're going to immobilize the lower leg, the knee, and the ankle to help make this patient more comfortable. So starting out with, we've got our gloves on. I'm going to go over our equipment real quick. So for the lower leg, I have two long padded board splints. These also come in a short padded board splint variety that's half the length. I have what we call a SAM splint, which is a long flexible padded board that we can shape to almost any shape, size that we need. And then I have some ACE bandages which we are going to use to secure the whole thing in place. Whoop, I'm going to throw one at Paige. Alright, so to start out with, when we come in to a patient who has a fracture, the first thing we need to do once we have BSI, scene safe, is have someone stabilize that fracture so that it's not rolling around, flopping around. Keep it stable, which will reduce pain for the patient. So Paige is going to stabilize this lower leg. So if you notice, she's supporting underneath the joint and then underneath the fracture itself, being sure not to put too much pressure on the fracture. Now that we have it stabilized, I'm going to check CMS, so circulation, motor, and sensation in the affected leg to see if the fracture has damaged nerves or blood vessels. So check a pedal pulse. Have the patient wiggle his toes for me, which probably will hurt. And then which toe am I touching without looking? Now, if we are missing, especially circulation, and we can see that it's turned in such a way that it is impeding that, you can take one attempt to return it to an anatomical position to try and restore blood flow. It's going to hurt the patient a lot if you do that. So make sure that you actually need to do that before doing so. So my patient though has perfect circulation, motor, sensation in that foot, so I don't need to attempt to return it to an anatomical position at all. So let's start immobilizing. The first thing I'm going to do is I'm going to take a long padded board splint here and go underneath of the injury. This helps take care of the knee because the knee can no longer bend with that padded board splint underneath of it. But just to be extra sure, I'm going to take one more and put it outside of the leg. So now that knee cannot move at all, but the ankle is not secured yet. I can still move back and forth. So I got to do something about that ankle. There are a lot of different ways that you can secure an ankle. I'm going to show you one good way. When we practice this in class, other people will give you other ideas on what you can do to help with that, but I'm going to show you one way here. So I'm going to take my SAM splint. As you can see, I've already folded it in half. And now I'm going to fold it into a U shape. And I'm going to take my ends here and just give them a little bit of a bend. And I'm going to create a stirrup with this. So Paige, wash your hand here real quick. So I can just tuck that right inside there. So I've got it tucked inside my long padded board splint. I've got it shaped to their ankle. And now, with that in place, their ankle can't move back and forth. So now our next step is to secure this in place. When wrapping for fractures, we always start distal and work proximal. That way we don't trap blood down here, because trapping blood is painful and eventually bad for tissue. So I'm going to start wrapping, working around Paige's hands. Not too tight, because I don't want to cut off circulation with my wrapping job here. So I'm going to go over and around, securing that foot and ankle and lower leg all in place. If I did it right, his ankle doesn't move. Perfect. So now I'm going to go, I've immobilized below, now I'm going to immobilize above. And I like to wrap one here, being sure that we don't wrap over the fracture itself, because that's going to be painful. One wrap here above the injury but below the knee. And then one above the knee, but we don't want to actually wrap over the knee, because once again that can cause hyperflexion and damage knee ligaments. You don't want to have to pay for their ACL surgery out of your own pocket. Now I've got that wrapped. I'm going to check and make sure if I have a void. I've got a little bit of a void there behind their knee. So I would take a towel or a 5x9 and pad it in there just to pad that little void, help support the knee. So now they can't move at all. So now the last step is recheck CMS. So I'm going to check pedal pulse. Wiggle your toes for me. It'll probably still hurt. Without looking, what toe do I have? They correctly identify the toe. So now this is properly secured. Paige can let go of stabilization because our splint is doing that for her now. And now we can get our patient packaged up for transport.